Welcome everyone, and I want to thank you for being here today. I'm here to share something with you that happens every day that you can't even imagine. Come along with me as I paint this picture, and you will know why I'm trying to raise awareness for this cause. When you get pregnant, you're so excited to see that plus sign. You can't believe your life is going to change, but deep inside, all you want is for your little one to be healthy. We all know that there are risks involved, and they do test for certain diseases. All of those tests come back negative, and now 9 months later, you're holding your little baby. He passed a newborn APGAR test, came back with flying colors. He scored an 8, and according to kidshealth.org, this is a passing score. However, a couple of days later, you notice that there's just something wrong. He doesn't feel right. He's lethargic. He's starting to run a temperature. Could you just be paranoid, or is he already sick? When the nurses come in to check him, he has a fever. Some observation and antibiotics, a couple of days have passed, and he's not getting any better. A few weeks have now gone by, and his cold has turned into pneumonia. He also now has a yeast infection that just won't go away. He's not responding to any of his medications. The doctors have been running tests to see what's wrong, but none of them are coming back conclusive. After 2 more long weeks, the doctors tell you they will need to be transferred to the children's hospital, and hopefully they will be able to find you some answers. What could possibly be wrong? Why can't the doctors figure this out? How is this happening? He's so young. Is this my fault? What did I do? These are all questions you will ask yourself when something horrible happens to your child. As you prepare to make that 4-hour trip by ambulance, you pray to hopefully find some answers. Finally, you get there, and after 2 long days of testing, watching your baby be poked and prodded, the doctor comes in and says, "We have some answers for you." You feel relief. If they know what it is, you can finally get him better and go home. However, you were not expecting the next words to come out of his mouth. "I'm sorry, Miss Smith, but your son has SCIDS." You stop listening. Your mind is running a mile a minute. What is it? How do we treat it? Is it curable? Does anyone even know what it is? I've never heard of this. Finally, after calming down, you start to look for answers. SCIDS is an acronym for Severe Combined Immunodeficiency. As defined by the Children's Hospital of Wisconsin, SCIDS is a group of very rare, life-threatening diseases that are present at birth. The disease causes the child to have very little or no immune system. As a result, the child's body is unable to fight off infections. This disease can be inherited, or it can be a genetic mutation. According to the University of Chicago Medicine, babies born with SCIDS develop infections and diseases like pneumonia, sepsis, yeast infections, meningitis, and many, many others. The sooner it's diagnosed, the sooner you can try to treat it, giving your little one a higher chance of survival. There are numerous treatments available. However, the success rates of treatment are iffy. There's one treatment for cure, which is a bone marrow transplant. If found and administered within the first 3 months of life, the survival rate can be as high as 97%. That's according to Medscape. However, finding out that your child has the disease, finding the correct strain for the disease that's compatible with this treatment, and finding a donor match makes this all extremely hard. After all, there is still the possibility that the transfer won't be accepted by the baby's body. Wikipedia states that there are also other forms of treatment, from monthly injections to boost your immune system, that'll obviously be needed for the rest of his life, from fighting each infection as it comes, but this can be very dangerous and costly. Other options is living in a sterile environment, like that 1976 made-for-TV movie with John Travolta. It shows the life of one special teenager living with a disease and what it's like for him. I suggest you check it out and see it. It's called The Boy in the Plastic Bubble. It won an Academy Award and is nominated for 3 others. And this movie takes you into a world you never knew existed. There's also a controversial and trial treatment for genetic therapy. They have had very little success. 20 years ago, they had very little success. If a patient actually accepted the gene, there were long-term chances of cancer and organ failure. Recently, though, they have tried using different types of virus, which is having a good success rate and is a lot safer. It's still in the trial period, but is looking promising for the SCID community. Early screening is key. With every successful treatment of the immunodeficiency disease, it was found in very early stages of life. According to the U.S. National Library of Medicine, as many as 1 in 50,000 babies are born with a variant of SCIDS. The test used for detection is called the Treg test and looks for T-cell defects. It is a very simple series of blood tests. you look at this map, the SCIDS newborn screening started in Wisconsin in 2010 and is pilot testing in 5 other states: California, Louisiana, Puerto Rico, New York, and Massachusetts. These initial tests found that as many as 1 in 34,000 babies were born with some sort of immune disorder. However, it also found that as little as 1 in 162,000 babies were born with SCIDS. After the initial findings, it was advised to all states to screen for SCIDS. Not doing so and providing vaccination for babies proved to be fatal. Pennsylvania decided to do high-risk screening for babies. Texas and Arizona are doing their own pilot testings. In the 10 states in purple, Colorado, Iowa, Illinois, Minnesota, Michigan, Florida, North Carolina, Delaware, Rhode Island, and the District of Columbia have all been approved to initiate the TREC newborn screening. However, some of them still lack the funding to do so. All of these pilot testing information can be found on the Newborn Screening for Severe Combined Immunodeficiency Disorder report for the advisory committee. But even with these findings, where is the rest of the nation on these? How can we save babies? Easy. We talk about it. The more we talk about it, the more people understand. If we can bring awareness about this terrible disease, maybe we can make newborn testing a national screen and save lives of many babies. Think about all the heartbreak we will be saving parents and grandparents watching their little babies suffer. If you could save a life with a simple blood test, would you? Then let us start talking about this disease and make everyone aware. Stand up and fight the unknown. Here are some brochures you can take with a list of websites and information about the disease. Pass it around, talk to friends, family. Even one share on Facebook can help spread awareness and make more people knowledgeable about SCIDS. Now go out, spread that awareness, donate to the cause, just get people talking about it. Thank you.